This is still the Health Monitor Show, and this is the Assisted Conception segment, where we'll be talking about abortions. And with me to give more light on this interesting topic is Dr. Shola Akinniyi, a gynecologist and fertility consultant at TruCare Clinic. What is abortions? Is abortion in Nigeria illegal? That I can tell you for sure, it is illegal. In the northern part, there are laws guiding the illegality of abortion, and also in the west. According to research, you will spend about 7 to 14 years if caught in the act of criminal abortion. We'll be talking about criminal abortion, and Dr. Akinniyi will give us a lot of information about this. Stay tuned, do not go anywhere, because we'll be right back. Welcome back. This is still Assisted Conception on the Health Monitor Show. And before we went on a break, I did say that we'll be talking about abortion, particularly criminal abortion. A lot of people have come across the term abortion and have carried this out, legally and illegally. But do we really know about criminal abortion? Now, before we get into what criminal abortion is, let us sit back and listen to what Dr. Akinniyi has to say about criminal abortion from a medical standpoint.
So today we're going to look at the other aspect, which is criminal abortion. I like to go back a little bit to kickstart by defining abortion. By standard, abortion is the termination of pregnancy before the age of viability. Now, the age of viability depends on the ability to sustain or support life outside the womb. That is, when the baby is outside the womb, the age at which it can live an independent life with minimum support. So in the advanced worlds where there is better health infrastructure and support, the age of viability of babies is about 20 weeks, or at that point the baby will be weighing about 500 grams. But in the third world, as it were, places like Nigeria, where the infrastructure is still not the best, it means that abortion would vary from one country to another. But the minimum is that the baby will be weighing less than 500 grams, or less than 20 weeks gestation. So and like I said the other time, a lot of pregnancies terminates of their own accord without any intervention or inducement from, without being intended. That is to say that they are spontaneous, they just happen. And to a large extent, many of them are not actually noticed, because some happen just before the next menstruation, and therefore the woman may not notice that she had actually gotten pregnant and the pregnancy was aborted. Most of this will be due to genetic problems, especially those that are not compatible with life.
Now, the one thing spontaneous abortion and criminal abortion have in common is the termination of the fetus. But are we aware that the conditions around spontaneous abortion and criminal abortion, also known as illegal abortion, differ? Yes, they greatly differ. Spontaneous abortion is when the abortion is not induced, and this can actually be due to genetic problems. But criminal abortion is when the abortion is actually induced. Is there a law, though, that supports abortion? With the aspect of spontaneous abortion, I can bear to think or wonder, is there a law that actually supports abortion?
So today we are going to discuss, like I said, criminal abortion or illegal abortion or induced abortion. That is, abortion that is not supported by law and brought about by intervention. That is, they are induced. So in this respect, yes, let me just say now that the difference between spontaneous and criminal or illegal is that, as it were, it is not supported by the law of the land. That is, there is no legal justification for the abortion. So you will want to ask me, is there any law that supports abortion? Yes, there is a law that prescribes under what circumstance an abortion can be performed. In the northern part of Nigeria, in the 1960s, which was revised in 1990. It's governed by the penal code. In the southern part of Nigeria, it is governed by the criminal code. And both of them seems to prescribe a maximum of 14 years for the person that helps to abort, that is abortionist. And the mother who aborts gets anything in the region of 3 years to 7 years, depending on the circumstances surrounding such abortions. So, yes, there is law in Nigeria, but the law specifies that abortion can only be procured if the pregnancy has been proven to have the likelihood or possibility of, taking the life of the mother. That is, the mother's life is in danger. For example, the mother may be suffering from a very serious heart problem, which may preclude pregnancy. That is, if the mother becomes pregnant with the pregnancy that is ongoing, the mother is likely to die in pregnancy. So the law prescribes that in such a circumstance, an abortion can be procured. This is legal abortion. The law does not give any other reason for procuring abortion except where the mother's life is threatened or may lead to death.
Legal abortion, for lack of better words, is actually targeted to the preservation of the mother's life when equipped licensed professionals have been able to prove that the pregnancy is a threat to the mother's life or the woman's life. In this case, the law supports the inducing of abortions with the sole purpose to just save the life of the mother. A lot of families lose women and mothers because of this. Why? Because in this part of the world, Nigeria, abortion carries a stench of abomination, most likely because of the moral values, complication, or mortality statistics.
So this is legal abortion. All other reasons are not good enough for for abortion to be procured or for an abortion to be induced. So this is the law in Nigeria. You can see that the law restricts abortion to a situation where the mother's life is in danger. Now, those abortions that are performed to protect mother's life can also be deemed legal, or they are therapeutic, that is for treatment purpose, that is to save the life of the mother. Now, the word induced abortion, or even the word abortion in Nigeria, connotes criminality. That is the general perception in the public, that once you say, okay, you want to procure an abortion, the interpretation by the public is that of criminal abortion. The connotation is that of criminality. What is the burden of abortion in Nigeria? Now, as it were, as in many other circumstances, the statistics or the figure for how many abortions are, performed in Nigeria, that is criminal abortion, the statistics is not so clear, and we don't really have an actual figure. But some studies have put the rate of abortion to something between 600,000 to over 1.2 million per annum. That is to say, over 600,000 to 1.2 million abortions are performed annually. Now, out of this, only 40% are performed by physicians or doctors. The rest 60% are performed by quacks, as it were, that is, untrained abortionists. So that is the burden of abortion, and we know that from works done by many research persons, about more than 50%, 50 to 60% of all abortions result in complications, one complication or the other. So abortion is never safe.
The estimated figures from a study shows that about 600,000 to 1.2 million abortions are carried out in Nigeria every year. And that's really alarming. What's most alarming is that 60% of these abortions are criminal abortions carried out by quacks. Some say that the reason why there are more cases of criminal abortions is because of the restrictive laws surrounding abortions in Nigeria. The Society of Gynaecologists and Obstetricians of Nigeria estimated that 20,000 women in Nigeria die from unsafe abortions every year. A nationwide survey was carried out in November 2022, and this showed that an estimated 610,000 unsafe abortions a year are carried out in Nigeria. And that's about half of the 20,000 women that die from the complications that come with unsafe abortions. And these women are adolescents. The death rate from unsafe abortions in Nigeria is thought to be the highest in Africa.
Now, when is abortion more likely to be procured? From statistics that are available, abortions are more likely performed during the second and third month of pregnancy. That is between the age of 8 weeks to 12 weeks of pregnancy. Now, like I told you, like I just said, the law prescribes that you can only perform an abortion if the mother's life is also threatened, if the mother is likely to die if she chooses to continue with the pregnancy. So what are the reasons given by most women or females that perform, that solicits abortion? Now, let us remember that the issue of abortion has its is related to the fact that people have not taken measures to prevent pregnancy, and what that measure is having a family planning in place. And remember that every woman or female that has attained puberty and engages in and is sexually active, if there is no family planning in place, such a woman is at the risk of pregnancy, and having gotten pregnant in a situation where she's ill prepared, then the next is that she wants to abort the pregnancy. Now, what are the reasons given? All reasons apart from the legal reason that I've just told you amount to social reasons. Some will tell the doctor, oh, I am schooling. I am too young. I am too young to get pregnant. I'm not ready to get pregnant. I have shame. I have guilt. My parents should not know about this. Some would say, I am not married, so I can't get pregnant because I'm not married. Or some get pregnant and they say they are not sure of the ownership of the pregnancy, so they need to get rid of it. So these are the reasons that people give when they approach those abortionists for abortions, and these are not good enough, unfortunately. Like I said, it is only when the mother's life is threatened or may likely be in may result in death that the law prescribes or allows a doctor or a health giver, caregiver to procure abortion.
Because of the high-risk nature of abortions, there are possible complications that come with it. A lot of women that go for abortions, legal abortions, need to understand that there is a designated timeline for abortions to be clinically carried out. Now, we all know and understand that every woman has different reasons to undergo an abortion. But the question is there any time an abortion can be safe, even when being induced legally?
So the question is there any time that an abortion is safe? No, abortion is never safe. Even in the best of hands, the fact that a doctor or a physician performs an abortion does not mean that the abortion will be safe. Now, but there are some dangerous times or dangerous or risky circumstances that may increase the probability of complications and that things may go wrong. Number one, if the girl or the adolescent or teenager is very young, abortion is likely to be very risky. Or if the abortion is also risky in very old people, that is people in their late 40s and 50s, abortion is very risky. Now, abortion for all ages is risky when the pregnancy is advanced. That is to say, it is no longer in the first trimester or the first 12 to 14 weeks of pregnancy. Abortion is more risky when the pregnancy has advanced. Abortion is also risky when there is more than one baby in the womb. That is, when there is multiple pregnancy. Abortion is risky when there is multiple pregnancy. Also, abortion is risky where there is an existing or pre-existing medical or surgical conditions. For example, a woman may be sick, maybe it's a sickler. When I say sickler, maybe suffering from sickle cell anemia or has a heart disease that before she became pregnant. In such circumstances, abortion is more likely to be risky, or there is higher risk that things may go wrong in such areas. Where there are the likelihood of infections, abortion is also very risky. Abortion is also risky if the woman has has procured abortion previously, or multiple attempts at abortion, or even in the index abortion. If, for example, the woman has seen a quack in the neighborhood or in the society, they have tampered with the pregnancy, he has taken drugs to tamper with the pregnancy, took some concussions and all that, then ends up even at the doctor's table for abortion or post-abortal issues, such cases may likely progress to severe complications.
Abortions are extremely sensitive, and that is why it's very important for a licensed practitioner to actually carry out legal abortion after proving that the woman or mother's life is threatened by the pregnancy. Age, underlying health effects are factors that need to be considered before carrying out or inducing abortions. And remember, criminal abortion is illegal, and anyone who engages in criminal abortion and is caught stands the risk of spending 7 to 14 years in imprisonment. This has been very informative and packed, and we'd just like to thank Dr. Shola Akinniyi, gynecologist and fertility specialist at TruCare Fertility Clinic. We have talked about criminal abortions, we have talked about the risks, the possible complications, and we have also talked about the timelines where legal abortions should be carried out. And we also did speak about criminal abortions and the jail terms that actually come with it and more. We're not done with this topic, criminal abortions. There's still a lot more to uncover. So stay tuned on assisted conception on the Health Monitor show. Until next time, I still remain your lovely host, Joan Mbanefo Ologe. This is the Health Monitor show, your guide to good health.
It's Health Monitor, #1 health show.